There is no shortage of scary heart disease statistics. It's the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 34 seconds of heart disease. Heart disease is the cause for 1 out of every 5 deaths in the U.S. on an annual basis. Some heart disease risk factors are beyond patients' control. Healthcare professionals can help them mitigate the ones that aren't. Many factors can increase or decrease a patient's risk for heart disease. Heredity plays a significant role. For example, familial hypertrophic cardiomyopathy and familial hypercholesterolemia are commonly inherited conditions. Lifestyle choices also impact a patient's level of risk. The Society for Cardiovascular Angiography and Interventions has outlined some of the biggest contributing factors to heart disease, including smoking. Smoking causes blood vessels to constrict, increases blood pressure and cholesterol levels, deprives the body's tissues of oxygen, damages blood vessels' inner lining, enables plaque to grow inside of arteries, and increases the likelihood of dangerous blood clots. High cholesterol. High levels of LDL cholesterol, or bad cholesterol, increase the buildup of plaque in the arteries and heart. But it's also unhealthy to have low levels of HDL. High blood pressure for long periods of time can damage the blood vessels, increasing the likelihood of cholesterol plaques forming and causing the artery walls to become thicker and stiffer and less able to expand and contract with changes in activity and physical demands. Being overweight or obese puts stress on one's heart and makes controlling high blood pressure more difficult. Overweight individuals are more likely to develop cardiovascular disease, and obese patients are at even greater risk. Physical inactivity weakens muscles and makes it tougher to control other heart disease risk factors, such as blood pressure, cholesterol levels, diabetes, and obesity. A lack of physical activity also raises the difficulty of managing stress, which research has linked to a greater chance of developing heart disease. Patients can't do much about their age, gender, and family history, but what can healthcare professionals do to help their patients mitigate risks? They can encourage prudent diets, exercise, stress management, and avoidance of tobacco products. Education is also fundamental, either in the form of counseling or providing educational materials. Physical therapists and other healthcare professionals can and should play a role in educating patients on the value of healthy behaviors, as well as encouraging them to embrace these healthy habits.